Yeah, very good.
Hello. World Cancer Day reminds us that while cancer may be a common enemy, but every patient's journey is personal. On the World Cancer Day, Voice of Healthcare brings to you a special initiative aligned with the global theme United by Unique, a powerful reminder that while the fight against cancer unites clinicians, caregivers, researchers, and policymakers across the world. Every individual's battle with cancer is shaped by their own biology, circumstances, and resilience. Over the years, oncology has moved far beyond a one size fits all approach. Advances in personalized medicine, targeted therapy, genomics, and immuno-oncology are transforming cancer care, making treatment not just more precise but more humane. To help us understand how personalized care is redefining the future of cancer treatment in India and globally, we are joined today by Dr. Suresh Hariram Advani, Senior Medical Oncologist at Reliance Foundation Hospital, a pioneer whose decades long journey has closely mirrored the evolution of modern oncology itself. Dr. Advani, thank you for joining us today.
Thank you. Thank you.
So, sir, to begin with, the theme of this year is United by Unique. In your decades of experience, how does the definition of personalized care evolve?
Yeah, I think as you mentioned, the cancer is on rise, and everybody is aware about it. And in last 100 years, the way the cancer is moving ahead is phenomenal, all because of the environmental and the lifestyle changes. But I think the most important thing which has happened during these 100 years is the changing values of the treatment. The treatment has radically changed, right from the first initially with alone small dose chemotherapy to high dose chemotherapy to the uh, targeted therapy, immunotherapy, and now the cellular therapy. So I think the way every decade almost the changes have been really seen. And that is what is really appears to be a promise for the patient suffering from the cancer because these changing modalities of the treatment, when applied properly, can produce the excellent result. I think one of them, the title or today's title, indicate that united by unique. What is the meaning of that? The meaning is that all of us are human beings. Remember that we are all, you, me, the viewers, all are human beings. But each one can be individually recognized. Why? Because our genes, they make our features. And that's how in the world almost every individual is unique, but although they are united as a human being. So that is a sort of a correlation that you have to do. Similarly, the word cancer creates a lot of fear in the people's mind. But again, cancer is not one disease; it's thousands of diseases together. And each cancer is also not one disease. Each cancer is, again, multiple subtypes of the cancer. So you can understand what a, uh variation that one can see. But most important thing is we are united by the unique. That's a basic thing. Breast cancer is a breast cancer, but it has got at least four to five, six types of the recognized features, each requiring different type of the treatment. So I think that is a correlation that today's discussion is going to go on. That how the field of the treatment and the cancer has radically changed from the what we used to call it the size which is fit for all. Every patient will receive the same treatment. Today it is not so. Today it is the that we have to give a size for a particular individual, and that's where the change has been seen.
Right. Rightly said, sir, that every patient is different and we have to understand the biology of the disease. For cancer, it is all the more important because the treatment plan definitely changes according to the genomics, according to the biology. And, sir, how do you balance, the global cancer protocol with the uniqueness of an individual's patient's genetic lifestyle?
Yeah, all of us have learned over a period of time with the hard work as well as the new information which is coming up, imbibing that, we have learned that how to recognize these individual subtypes of the cancer which will be responsive to a particular drugs. That's the biggest challenge that we are facing. But the challenge has been met with because ultimately, like what is cancer? Cancer is nothing but the normal cells which have been transformed to survive and disseminate because of some gene defect. One single gene defect can change the normal cells to the cancer cell. That is what is the cancer. Now, this gene defect can lead to the cancer. But again, gene defect need not be a single. It can be multiple gene defects. And therefore, you can have the lung cancer similar, appearing morphologically same, but having the different subtypes, different gene mutation. And that is how the recognition of that gene mutation have allowed us to develop the various drugs which identify that particular gene and ultimately uh, attacks that is what we call it targeted therapy and eliminate the disease. So you can see that how in the single cancer we have been able to identify the gene defect. I must say that in about 30 years ago, it was so difficult to do these gene testing. It used to take 3, 4 weeks, 6 weeks for the result to come. And we used to wonder how we are going to really. But today, the rapidity with which the technology has improved, we can get the gene defect identified within a short period of time within at least the immediate need within 2, 3 days, and maybe for a whole genome to be evaluated takes about 2 to 3 weeks. So you can see that how technology have allowed us to identify this quickly so that we can rapidly apply for our patients. I'll just
Right,
give you
sir.
one example.
Yes,
One
yes,
example I wanted
yes.
to lung cancer 30 years ago, 35 years ago, lung cancer was diagnosed. All of us, we were diagnosing lung cancer. And what used to happen? That time we had only simple chemotherapy. We used to give them some chemotherapy. They used to respond maybe for a few months, and ultimately the disease will progress. That was the situation. So lung cancer was considered a fatal disease. Today it is no more so. Why? Because I think it's important thing is we identify the various gene defect in the lung cancer cells. So as soon as the lung cancer is diagnosed, our first reaction is send the tissue for the gene testing. That is our first reaction. We do that. We call it next generation sequencing, and that is done as such.
Right, right.
So
I think
once we identify that gene, then we have a targeted therapy, which is in the form of the tablets. And some of these cancers disappear the tablets. I can never imagine say, 30, 40 years ago that I'll be treating lung cancer with a tablet. But today is the reality, thanks to the development of personalized care, which has been applied.
yes, sir. So you've got vast experience and must say that you have seen the evolution of treatment yourself with your eyes and you have been treating the patients. You can guide us, that how can these next generation sequencing and liquid biopsy, which are coming up, help us explain that these tools can specifically be used to personalize the treatment plan for a particular patient.
Yeah, you see now the identification of the gene defect has become a reality today, an essential thing to treat the patient. And that is possible. So all these factors have come up. It is possible in our setup. to be applied directly to the bedside on our patient and is easily available. Slowly, the cost is coming down. So I think it's a radical change that we have seen in this area. And I think today it has become a must for all of us to understand the biology of the disease. It's not just to say, well, it's a cancer. That's not the biology means why it has become cancer, which defect has produced this cancer from the normal cells. And that is where it is important. All these things have been identified by the scientists through the hard work in the laboratory. And that is how we have really developed in a way that we are able to really identify these genes. And once we identify these genes, we have the treatment. And that treatment also developed specifically for that particular gene. So remember, it's a hard work where the scientists in the lab have worked first to identify the gene defect and then identify that how the gene defect is producing the cancer and then attack that part of the full arc which is producing the cancer. So if you block that, you automatically block the development of the cancer. So I think this is what has happened. And I must compliment all our colleagues working in the lab, spending a lot of their money, lot of time, and lot of energy to work and trying to identify. And that is what has really ultimately helped the clinician like us to apply this to for our patient. So you can see it's a very hard work. And again, these gene things are being done on the tumor tissue. Normally, we have a paraffin block on which we can study the gene. Also, we did realize that some of these cells, like in lung cancer, if you see the blood examination, you will find few tumor cells or the tumor DNA, which is circulating. And we can identify that also. We can identify not only that, but we can identify the, again, mutation of the gene in those specimen. So I think that's where today what has happened is a phenomenal progress in terms of ease by which we can do the test. Tumor tissue is always available because of the good biopsy. And secondly, blood is always available to us because it's so easy to collect and so easy to isolate the tumor DNA or tumor cells in the peripheral blood. Even if we identify single cell, that can also give us the information. So I think that is the uniqueness by which the whole development has occurred. That today for us, a single cell can also give us a lot of information.
Rightly said, sir, that these newer techniques like NGS and liquid biopsy are definitely helping us to target the tumor better. But sir, with these tests, I think there is a lot of data, and wherein we feel that artificial intelligence is something which is definitely required to interpret it because humans cannot do that. So, with the rise of artificial intelligence in oncology, how do you see technology as as the tool that enhances the personal touch?
Yeah, I think people can say anything that artificial intelligence is not the human intelligence. Definitely, it's not human intelligence, but it is something close to the human intelligence, very close to it. And it can help our brain to really uh, add to the normal brain function. So I think that is where it is. Today, all of us are glued to the artificial intelligence. It gives us a extensive amount of the information in a very few seconds, and that's a beyond imagination. That in few seconds you get extensive information which is useful for deciding the treatment for the patient. So I think that's the most important thing is to understand that the cell is uh, sort of is controlled by not one gene. Cell is controlled by thousands of genes, and all these genes interact with each other. How do they interact? Again, for a normal brain, is difficult to imagine. But AI can recognize that. AI can give us the direction in that. And that's where AI has become really important. Most important thing is it can give you the update information in a very few seconds. So even if the molecule or some target molecule is identified somewhere in the world, it is there in AI. And AI can give you the solution. So I think that's where I think that all of us in the medical field have to be expert in AI, and
Right.
that's how we can do the better work for our patient.
Right. And I think it increases the speed with which we work, and definitely it is aiding us in augmenting our intelligence as well. Sir, while treating the patient, you must have learned a lot of lessons, over the years. So, how do you define that the personalized treatment or uniqueness of a particular patient while planning the treatment plan has evolved over these years?
Yeah, I think today the world has changed, so we have changed, and the important thing is when we see a patient, we want to give him the best of the treatment which is available till today. That's the principle. Anywhere in the world, patient wants to know what is the best treatment today in the world, and we have to give the answer to that. So I think that is where is the most important thing. That today we will not say you have breast cancer. No, that's not enough. That will not give you any clue what, how long, how you are going to respond, how long your remission will be there, whether you will be cured or not. All that information will not come just by word breast cancer. So what is it? That whether it is a hormone receptor positive or hormone receptor negative, there's another molecule, we call it targeted molecule, HER2 receptor, whether that is present or not present. And then the rate of multiplication, we call MIB index or Ki67 receptors. So you can see that now the pathologists have a big job when they get the tumor tissue, they have to give us all this information. Without this information, the report is incomplete. And we as a clinician will be little bit upset if all this information does not come in. So I think, but it's coming up. Like we have grown, the pathologists have become really activated today. They know what the clinician wants. So I think it's a development in every field that has occurred. So today once all the information comes on the table that I know now this is the information, then you have to talk to the patient. Tell him that what is the best treatment today. That look, you are HER2 positive, and we have a targeted therapy for that called Herceptin or Perjecta or so many other uh, targeted therapy. So we have to give that along with the chemotherapy, and your response rate will be really very good. And we have newer molecules in the case of relapse, better molecules, antibody uh, drug conjugate, all these things are coming up. So I feel that today the time has come that we can individualize the treatment for the patient. And I think that is what is meant by the personalized care. And I remember the days when first Herceptin came, and Herceptin was used for everybody. It was a failure. The trial was a failure. Why? Because it was even given to the HER2 negative patient. But once we identified the HER2 in the laboratory and gave Herceptin only to those patients, trial was a big success. And even today, it is one of the really sort of considered to be a great discovery in the field of the breast cancer. So you can see that how the things have changed, not only in the personalized care for the patient, but also in terms of the drug development, the drug trial. This is really helping us a lot.
Right, rightly said, sir. The report has become more elaborate, and so does the treatment. Sir, personalized care often comes with a high price tag today. And as a leader in this field, how can help us understand that these treatments are made accessible to any average Indian patient?
Yeah, I think uh, I always believe that if you don't keep up with the information, scientific information, which is coming up, whether it's a basic information or clinical information, clinical trial results, if we don't keep up with that, we can be outdated within 6 months.
Hmm.
That is a type of the information which is coming up every day. I think a lot of new information is coming up. And for us, it is important to imbibe those information. And that's why you find that now, because the information is so huge, that ultimately our uh, area is becoming smaller and smaller. We are getting to the focused area, but being in the focused area, we are able to deliver the better treatment to our patient. So it has got again a tremendous advantage in terms of the focused area of interest and becoming the expert in that area and then giving the most expert treatment for our patient. So I think this is where the whole development has allowed us to deliver the best treatment.
Right, sir. Sir, I have some rapid fire questions for your intelligent and learned brain, sir. So,
Yeah.
first question is targeted therapy or immunotherapy, which is the bigger game changer?
Well, I think immunotherapy has got a very wide net, because
Yes.
it's almost it is becoming coming to the term that is being used in more than 50% of the cancer. So I think immunotherapy, but that does not underscore the value of target therapy. Target therapy has it, and in fact, I feel that immunotherapy is also target therapy because it modifies the immune cells to recognize the tumor cells and eliminate that. So, immunotherapy is also a target therapy. So, both are together.
Right. The biggest myth about cancer you want to bust today?
What?
The myth, any myth about the cancer you want to bust today? Myth.
Yes. Oh, there are thousands of myths in the people mind. Every patient comes, they have a thing that they can't eat sugar. That's
Hmm.
an absolute myth. Nobody believes in that, but the patient receives the information from all around. And
Hmm.
second most important thing which I find is biopsy. Everybody is afraid of biopsy. Say, why you are afraid? Oh, because it spreads the tumors. Again,
Hmm.
that's a total myth. Biopsy does not spread the disease. And lastly,
I,
most of the people believe that cancer is not curable. In today's world, the cancer is the most curable disease. Some of them are, we can confidently say, 100% curable. Look at the Hodgkin disease, acute lymphoblastic leukemia, non Hodgkin lymphoma, early breast cancer. They're all curable cancer. So look at that, that how this myth is going on because of the long-term memories of the in olden times where the people used to die.
right, sir. And so, one word to describe the future of Indian oncology.
Yeah, I think the cancer is going to increase, but I'm sure side by side, our information about the biology of the cancer and its treatment is also going to really make a big dent in the terms of the cancer cure. And I think time is not very far. With so much of the understanding that we will develop a sort of a solution for this in terms of one, which is important, the prevention. 50% of the cancer today can be prevented. Similarly, early diagnosis. We will have so much of technology to diagnose the disease early, and that's where the cure is possible. And lastly, even those patients who have advanced disease, we can really treat them well. They are treatable, treat them well, and give them the life which is validated in terms of the quality of life. So I think at every front we have a win-win situation.
Right. And sir, AI in cancer care, a helpful partner, or is it overhyped?
AI is the integral part of each area that I told you just.
Right.
Every area. AI is becoming the part of it, whether it is in prevention, whether it is in early diagnosis. Today, the mammography is being read by AI, not by the human eye. Human eye can make the mistake, not the AI. So
Yeah.
that's a situation which has happened. Similarly, in terms of the treatment, also, the new technology are going to be available for everybody, even the medical oncologist who's sitting in a small town somewhere. He knows what is happening in the world. So I think that's where the AI is going to play an important role. So, in other words, what will happen is that as compared to the previous or past, where only few people living in the cities used to take the advantage of the treatment. But today, everybody, even in living in a distant village, can take the advantage of the modern medicine.
Right. And sir, early detection or precision medicine, which saves more lives right now?
Absolutely. Early detection is the most important thing. It
Yes.
saves the life. Not only it saves the life, it saves the organ also. Like breast cancer. Today, 90% of the breast cancer, we are doing a partial surgery. In contrast to previously, where we used to do 90% of the time the radical surgery. So you can see that early diagnosis saves the life, saves the organ, and makes the person confident.
Right, sir. And sir, for someone watching us today and maybe battling the unique cancer they are suffering from, what is one message of hope you want to give them?
Yeah, I think the message is that science is in your hand. Science is where everybody is trying to help the patient. You keep up the hope. Never leave the hope. All of us, every one of us, we live on the hope. And that hope we must carry on. And with the hope, we can live.
Yeah. So I think people must have understood the uniqueness of battle they are, facing, and definitely the last message of hope which Sir has given would be beneficial for them. With that note, Sir, I thank you for joining us today in this
Thank
important
you.
discussion.
Thank you very much. Thank you.